and these were donated by Procter and Gamble. Now, the donation consists of over 22,000 sanitary towels, nearly 8,000 nappies, 466 toothbrushes, and 36 packs of aerial washing powder. Sanitary towels remain essential goods, particularly during the COVID-19 pandemic, when supply lines for the products were affected. The department maintains that girls and women should be able to manage their menstrual cycles with dignity, and that periods do not stop during pandemics. Mkhize says the department is also faced with a growing number of gender-based violence cases.
When we talk of menstruation,
and the whole care of a woman
in her livelihood
would be that
you will know,
not today,
not tomorrow,
not today, not tomorrow,
that
10 years to come.
Procter & Gamble had chosen
the
correct partner.
A good
We have
partner.
almost 30,000 sanitary menstrual hygiene and health products. This is a symbolic handover. I hand over to yourselves, ministers.
I hand over to yourselves, ministers.
Greetings to everyone across the continent and globally joining us for this very necessary webinar on moving the needle forward on menstrual health in South Africa, which is co-curated by the South African Coalition on Menstrual Health and Hygiene Management and the Mail and Guardian. The South African Coalition on Menstrual Health and Hygiene was established in March 2020 as a South African arm of the African Coalition on Menstrual Health and Hygiene Management, made up of a joint coalition of government and civil society. The coalition aims to promote and advocate for access to services regarding puberty and sexual health and broader issues of menstrual health management, including water supply, sanitation, hygiene, and waste disposal. It is a coordinated effort on menstrual health and hygiene management to provide a platform for different stakeholders to collaborate on a variety of topics that raise awareness on realizing the commitments made by the South African government. Girls' and women's ability to manage their menses and menstrual health is more than just a biological process. It is an issue that is fundamentally shaped by the political and socio-economic structures at the heart of empowerment, gender equality, and the sexual and reproductive health and rights of all girls and women. The deliberate and intentional coordination on menstrual health management remains paramount in the menstrual hygiene landscape, and this has been further compounded by the multiple challenges exacerbated by the COVID-19 pandemic. My name is Sonwabise Mzinyati from Global Citizen, and joining me today to unpack how we can move the needle forward for menstrual health management in South Africa is an amazing panel of experts on menstrual health and hygiene management. Please join me in welcoming the Honorable Minister of Women, Youth and Persons with Disabilities from South Africa, Minister Nkoana-Mashabane. Minister Nkoana-Mashabane has been a member of parliament since the advent of our democracy in South Africa in 1994, a former High Commissioner of South Africa in several countries. She has also served on various ministerial positions, including as Minister of International Relations and Cooperation and Minister of Rural Development and Land Reform. She's extremely passionate about women affairs, having served on the ANC's Women's League and provincial convener of the Progressive Women's Movement in Limpopo. Welcome, Minister. Please also join me in welcoming Ms. Beatrix Mutali, who is the UNFPA representative for South Africa and country director for Botswana, as well as Eswatini. Ms. Mutali has a wealth of experience in both international and local development, including experience in program management, particularly around family planning and HIV/AIDS. Prior to her appointment in her current role, Ms. Mutali spearheaded developmental projects as the UNFPA Deputy Regional Director for West and Central Regional Office, and also as the Officer in Charge for UNFPA Nigeria. A very warm welcome to you, Ms. Mutali. Allow me to also welcome Mr. Elijah Adera. Mr. Adera is the Regional Program Manager for Water, Sanitation and Hygiene at WaterAid. He has had a fruitful career covering development and management in economic empowerment, sustainable livelihoods, education, health, human rights, environment, and water, sanitation and hygiene in developing countries. In his current role, he oversees the development and implementation of country and regional water, sanitation, and hygiene programs in Southern Africa. And lastly, but not least, let me welcome Ms. Thobile Mtiane, who is the Deputy Director for Policy Coordination and Assessment at the Department of Water and Sanitation. Ms. Mtiane is highly experienced and equipped with skills in environmental health and water and sanitation and management. She has extensive public service experience in both health and water sanitation relating to policy, legislation, regulation, strategy development, implementation, and assessment over many, many years. This webinar will be broken down into two parts. The first part sets the scene and context for the existence of the South African Coalition for Menstrual Health Management. And the second part gets into the various elements of advocacy, tasks, and programs of actions that are being implemented in South Africa to move forward for menstrual health management. In terms of participating in today's webinar, those of you who are part of the audience should please keep yourselves muted, but feel free to engage us on the chat, which should be on the right of your screen. And you can ask any questions, you can provide us with comments, and we are really, really looking forward to engaging you today. To my panel of speakers, welcome to the inaugural panel on the very first webinar that we are hosting as the South African Coalition of Menstrual Health Management. Kicking us off, I'd like to request the Honourable Minister if she could take us through the role of the Department of Women, Youth and Persons with Disabilities role as the Secretariat of the South African Coalition for MHM and its objectives. Over to you, Minister. Sorry, Minister, we are struggling to hear you. Admin, can you please check if the Minister's audio is on? Can we test it again? Minister, please speak.
Hello, can you hear me?
Perfect. Yeah. Welcome, Minister.
Well, I was just acknowledging and thanking you for being our chief director, our chief of program for today. Also, country representative of the UNFPA, Mr. Elijah Adera, country representative of the WaterAid, Mr. Thobile Mtiane of the South African Coalition of Menstrual Health and Management, Ms. Sonobile Mzinyati, Senior Manager, Global Policy and Government Affairs, Global Citizen. Ladies and gentlemen, good afternoon.
Good afternoon.
Sanitary dignity in South Africa means that every girl, child, and woman in the country can manage their menstruation in a dignified manner. This means that all girls and women, irrespective of socio-economic status, would have had their menstrual information and knowledge. They should also have menstrual products, safe, hygiene, and private spaces to carry out their menstrual health and practices, and would be able to walk away from these activities feeling clean and hygienic. A clean and reliable supply of water must be available to girls and women for these purposes. This include the toilets where they change their menstrual products should be cleaned, or the place where they change should be clean, private, and safe. They should have access to material to hygienically clean themselves, such as toilet paper, and have access to hygienically dispose of used products. Water supply and sanitation and hygiene is a fundamental requirement for equality in appropriate facilities needed for achieving sanitary dignity in South Africa. That's WASH. As discussants have and will continue to outline, we must take a holistic approach to menstrual health and management. This includes 3 essential components, which is access to appropriate menstrual material and additional appropriate material for storage, washing and drying, adequate infrastructure for water and sanitation, changing areas, and waste disposal mechanisms, as well as menstrual health, education, and promotion. Similarly, the sanitary dignity implement, which framework addresses menstrual health and hygienic using a comprehensive approach. This approach includes access to products and education and water, supply and sanitation, and hygiene. It is against this background that the response to COVID-19 will adopt 3 interventions: products, WASH, and education. Part 1, Department of Women, Youth, People with Disabilities role is as the Secretariat of the ASACHM, and objectives thereof is, Chairperson, allow me to discuss the role of this department. I want to first echo the investment case for menstrual health and hygiene report published in November 2020 that the addressing of menstrual health requires a holistic and therefore a multi-sectoral approach, which ensures that menstrual health is addressed in the fields of public health, education, SRHR, gender equality, water, hygiene, and sanitation, and environment. It is also cutting across the various locations, households, schools, out of schools, workplaces, and institutions outside the school, the humanitarian, which includes the humanitarian settings. A multi-sectoral approach will also be needed to implement the programs and at scale, ideally through working with strengthening and existing government systems. Is there a query? Therefore, the launch of this program is in March 2020, which was timely. South Africa remains as one of the few countries that takes menstrual health coalition serious. Objectives of the coalition were and will remain to strengthen coalition among the key stakeholders working on menstrual health in South Africa, enhance collaborative partnerships, resource mobilizations efforts, and advocate for menstrual health and policies for effective and suitable menstrual health and hygienic management. Unlock the domestic and international government and private resource for menstrual health. Provide for a platform for learning and sharing amongst the stakeholders to trigger opportunities for taking programs to scale. Link with the regional efforts such as the African Coalition for Menstrual Health Management. As a department providing oversight over center dignity, implementation framework which guides the menstrual health landscape in South Africa, we have been playing a secretariat role, and since the inception of this initiative. This role is significant because government is committed to make the multi-sectoral partnership of menstrual health a resounding success. In addition, for the coalition to work in a cohesive and integrated manner, there has to be a champion and a political will. As the Secretariat, we have done the following: compile a database of members from government departments, civil society, NGOs, manufacturers, and UN organizations, etc. Developed terms of reference for the organization. Developed terms of reference for the various task teams that are operational engine of the coalition, and ensure that those task teams meet and draw programs of action which become the program of the entire coalition. Convene sessions which within the course of the year, and convene the steering committee as it is necessary, as and when is necessary. The above demonstrates the commitment the government has in ensuring close convergence between itself and various partners in the menstrual health space in South Africa. This is clearly articulated two of the SDIF objectives: to provide for an integrated and coordinated responsive government programs aimed at provision of sanitary free of charge to indigent girls and women. Two, to provide the interdepartmental and intergovernmental cooperation. Therefore, the coalition building is better to do more. Part two, the government of South Africa is in government of South Africa's investments in alleviating period poverty. The government of South Africa aims to reduce period poverty amongst the following groups: urban and rural quintile 1, 2, and 3 schools, and rural quintiles 4 and 5. Especially,
Minister?
yes.
I want to request that we read part 2 in the second part of the webinar, if that's okay with you.
Yes, as long as we manage time. I need to be
course.
out of here by 3:30.
Of course.
Okay.
Of course. Thank you so much, Minister. And just to say, if you were listening, the Minister has highlighted the importance of menstrual health as a human right for all women and girls, and that it requires a holistic, multi-sectoral approach. And if you're joining us if you've just joined this webinar, welcome to our webinar again on moving the needle forward for menstrual health by the Mail and Guardian and the UNFPA in partnership with the Department of Women, Youth and Persons with Disabilities, led by the South African Coalition on Menstrual Health Management. On that note, I'd like to call on Ms. Mutali to take us through the UNFPA's role in moving the needle forward on menstrual health. Over to you, Ms. Mutali.
Thank you very much, moderator, on that question. I'd like to also join the Honourable Minister in recognizing the fellow panelists, the Honourable Minister in the Department of Women, Youth and Persons with Disabilities, the Regional Programme Manager for Water Aid, and the Director, Department of Water and Sanitation, and very importantly, the distinguished participants. It gives me a great pleasure to be part of this esteemed panel and to participate in this topic which is of mutual interest. Once again, thank you for the opportunity to reflect on the past year and how UNFPA has contributed to moving the needle forward in menstrual health. The past year, as we all know, has been a year that has required a lot of flexibility and adaptation from all of us. We have all learned to do things differently, and in so doing, we've also learned that we can be
Ms. Mutali, we seem to be losing you. Can you hear us?
And this webinar is one of those good examples.
She's back.
For you,
oh, Ms. Mutali, we're really struggling to hear you. I'm going to humbly request that admin. I'm going to request Ms. Mutali. Oh, do you want to try again? Okay, I'm going to request that admin assist us with getting Ms. Mutali back online. For now, I will move on to Mr. Elijah Adera, who will be representing WaterAid's role in raising awareness on menstrual health using the South African Coalition MHM as a platform. Over to you, Mr. Adera.
Thank you very much, program moderator. And first of all, I would like to also acknowledge the Honorable Minister of the Department of Women, Youth and People with Disabilities. Acknowledge the country representative for United Nations Population Fund. I would also like to acknowledge the director in the Department of Water and Sanitation and all other distinguished guests that are in this webinar, all protocol observed. Yes, so I just want to be very, very quick and to summarize, to say water actually, both in the country, South Africa, and globally, we really are always focusing on menstrual health and hygiene, and because we recognize that you know, if we don't focus the attention, especially contributing to ensure that many women and girls out there have access to clean water, you know, decent sanitation and hygiene, then we would not be actually doing justice to the menstrual hygiene cycle that actually many of our women and girls are undergoing throughout the world, and especially here in South Africa. So one of the key role that we have played since the menstrual hygiene coalition and health coalition was established, we know that we have to work with our partners, and I think the Honorable Minister has indicated very well. The Department of Women and Youth and People with Disabilities are playing a major role to coordinate and support as a secretariat other role players in this regard. So for us, I think one of the major contributions I would say is we have invested quite a bit of money partnering with other stakeholders like the private sector, that is Kimberly-Clark's, to actually invest almost 8 million rands so far to build what we call female-friendly toilets and wash facilities in already 9 schools in Limpopo, in Bembe district. And we are working very closely with the local NGO called Songang, and also the Department of Basic Education and the municipality in Vembe. And this has actually enabled so many, almost about 4,000 learners, and more than half of these are actually girls, to access what we call female-friendly toilets. So when I mention female-friendly toilets, we have modeled toilets that have facilities that enable girls to have their, you know, that they can use the toilets which are private, comfortable, and also have water in it, and they are able to change their pads, and also there's a bins to be able to actually dispose of the pad, the usable parts. So we have been trying to model female-friendly toilets, and we hope that most of other stakeholders across South Africa can also adopt this and promote this, so that we can address the issues of girls having challenges in menstrual periods when they are in schools. So that's one thing that we have done, and maybe I would even say that we are again in the discussion with Kimberly-Clark's. We are negotiating for another, a further 1.5 million US dollars to actually also support another additional 10 schools. And we are hoping we can reach more than 7,000 pupils again in the next 3 years from now. So that's and most of these 7,000 will be, half of it will be almost girls, basically. And we will be promoting the girls-friendly toilets. So that's one key role. The second one, I would say, I'm so happy to see the minister here, the Honorable Nkoana-Mashabane. And I want to acknowledge first the fact that in July last year, June, July, we teamed up with the United Nations Population Fund, the Ministry of Women, Youth and People with Disabilities, and we managed to contribute sanitary pads, to contribute soap, masks, and sanitizers to several women centers in Gauteng and other places to make sure that they also have menstrual products that they during the lockdown. So that contribution was, we actually invested almost 800,000 rands there. And I want to acknowledge the minister for her bold leadership, where I think the same year in July, he announced more resources, I think budget resources in Parliament, to be able to cater for, sanitary pads to the women and girls in poor communities. And I think that's a bold leadership that we all acknowledge the minister taking. And we would like to compliment the minister to continue diverting the resources where they need to be, especially for women and girls for sanitary products. The last thing I would like to mention, we have also teamed up with UNICEF during COVID-19, and we have, since we know that water, sanitation, and hygiene is important to ensure that women and girls are able to go with dignity, have their menstrual hygiene with dignity. We have partnered with UNICEF, and we have installed several water tanks and hand washing facilities in about 62 hand washing facilities in informal settlements in Gauteng, and also in the rural areas in Limpopo. And this actually has been very, very important. Most of these are in schools, they're also in healthcare facilities, but also in communities. And we ensure that this access to water is important for women to actually be able to clean themselves during menstrual cycle. And we have partnered with maybe I need to acknowledge the Department of Water and Sanitation. This is one thing that we have partnered with them, and the city of Johannesburg has also been providing access to water to these facilities. So I think I would stop there for now. Thank you.
Thank you for that, Mr. Adera. I think you have raised some really key points that are required towards menstrual health and WaterAid's role in building female-friendly wash facilities, enabling an estimated 4,000 learners, and the further investments WaterAid will be making to enable a further 7,000 young girls have access to female-friendly wash facilities. Next up, I would like to invite Ms. Mtiane. She will present on the South African Coalition MHM's role in moving the needle forward on menstrual health and building better together. Over to you, Ms. Mtiane.
Thank you, Chair. I want to also acknowledge the Honorable Minister Nkoana-Mashabane and my fellow panelists in this first session. My role is really to highlight how the coalition has really contributed in improving menstrual health management in the country. And I want to start by highlighting the fact that the coalition is the vehicle that brings together all the like-minded stakeholders in the sector. And they come from different sectors. We have government, and not just one department, a range of government departments. We have civil society representatives in a form of NGOs. We have the research community, because we recognize that the work that we do must be informed by evidence. And that will help to also improve in terms of the impacts that we want to achieve. So the Alliance is really working towards achieving a holistic menstrual health management for the country, by the country stakeholders, which include government and civil society and our research partners. It plays this critical role by achieving one of the things that the country wants to see is social cohesion, and it does this by the demonstrated unity and commitment that we have seen. You've heard my fellow panelists, outlining the various contributions that they have brought to the table. So there is a clear demonstration of how the coalition operates in terms of each individual institution that is there, contributing their time, their personnel, and their resources to make sure that the work that needs to be done is actually done towards the fulfillment of the sanitary dignity framework. The coalition also recognizes the strategic advantage of this collaborative work. So what we're trying to break down here is the silo mentality, the operating in parallels or competition by various stakeholders. Therefore, this eventually improves the impact on the ground, because this is one of the things I think that was really quantified by government at some stage, that if we really don't work in a collaborative manner, we end up focusing in one area and having some areas of whatever program are being neglected. So that is one of the things that the coalition is doing in moving the needle forward. The coalition is therefore centrally steered by a steering committee. This is a strategic leadership core of the coalition, and this steering committee is actually made up of different task teams that look at focus areas, and they include WASH, they include products to make sure that the products that we are issuing out there to our girl children are actually up to standard, and they do not compromise their health. We have a task team that looks at resource mobilization. We have a task team for policy governance and advocacy. This is very important because we have to have that policy enabling environment, and that's one of the advantage with all the government together being in one room to make sure that our policies are actually complementing each other and not creating any hindrances along the way. And getting the message out there through advocacy programs, then the research as well as education and health. So those are the task teams that are really informing the program of action that responds to the priorities as has been identified through the sanitary dignity framework. I think I will end there for now, Chair.
Thank you so much, Ms. Mutiane, stressing there that it is important for the coalition to be made up of like-minded stakeholders who are all building social cohesion and removing the silos on menstrual health management. She has highlighted that it's made up of government departments, civil society, and research partners, and most importantly, for the country and by the country. I'd like to welcome back Ms. Mutali. Ms. Mutali is going to be speaking to us and taking us through the UNFPA's role in moving the needle forward on menstrual health. Ms. Mutali? I think we have lost Ms. Mutali again. Admin will assist in getting her back online. I've also just encouraged everyone to put in the chat any questions that you may have. I'd like to welcome all the civil society that has joined us. I've seen a number of organizations that are quite familiar in the MHM space. I've also seen a number of academics, universities, and I've also seen a number of government officials who are also joining us today. I'd like to welcome you all. I have not seen any questions from you, but if you do have any questions, please feel free to add them to the chat. And that brings us, I guess, in the absence of Ms. Mutali, I really hope admin can help us to get her back online. But this essentially brings us to the end of the first part of our webinar on moving the needle forward for menstrual health by the Mail and Guardian, the UNFPA, in partnership with the Department of Women, Youth and Persons with Disabilities, led by the South African Coalition on Menstrual Health Management. We will now get into the second part of our webinar, which is on various elements of advocacy, tasks, and program of actions that the stakeholders made up at the South African Coalition for MHM have implemented to move the needle forward for menstrual health management in South Africa. Just to reintroduce my panelists, if you've just joined us, I'm joined by the Honourable Minister of Women, Youth and Persons with Disabilities from South Africa, Honourable Minister Nkoana-Mashabane. I am joined by Mr. Elijah Adera, who's the Regional Program Manager for Water Sanitation and Hygiene at WaterAid. I am joined by Ms. Tobile Mtiane, who is the Deputy Director for Policy Coordination and Assessment from the Department of Water and Sanitation. We also do have Ms. Beatrice Mutali, who is the UNFPA representative for South Africa and Country Director for Botswana and Eswatini. She is currently struggling to connect, but will be aiming to join us shortly. Minister, I know that the department under your leadership has been working tirelessly to address menstrual health management in South Africa. Kindly unpack how the government of South Africa has invested in alleviating period poverty and whether there are any examples which you can present that are currently being implemented on the ground. Over to you, Minister.
Well, the government of South Africa is currently engaged in reducing period poverty, as you said earlier on. Among the groups that we are focusing on is urban and rural quintile in schools, urban and rural quintile 1 and 2 and 3, and rural quintile 4 and 5 schools. Special needs schools and farm schools. Those who attend post-school education and training institutions. These target groups will be determined from the National Student and Financial Aid Scheme NAFSA's database and live in child-headed schools. There are households that are headed by children in South Africa, so they are also being taken in or counted in for support. This support group will be determined from Department of Social Department's social grant database and social school relief of distress, and indigent households have been admitted to state-owned institutions such as hospitals, mental health facilities, orphanages, places of care, prisons, and places of safety. Vulnerable indigent women and girls, not state institutions. Those that have been identified by an indigent sanitary management committee or provincial sanitary dignity committee. Government has unconditionally committed financial resources for the sanitary dignity program as from 2019-2020 financial year and into the outer years across the medium-term expenditure framework. A good example is that for the 2020-2021 financial year, the South African government has committed 217 million, 258 million rand to see to success of rollout of sanitary pads and to learners in all those provinces, all those 9 provinces. During this financial year, 2020-2021, or 2,236,519 learners in no-fee schools, farm special schools have received this consignments. In collaboration with the Department of Education, Water and Sanitation, we are addressing water supply, sanitation, hygiene issues in schools, in particular in rural and in environments, because This has been an implication on menstrual health and dignity of the girl. I'm pleased that WaterAid, as a partner of ours, is running a project to mitigate WASH in issues in Vembes district in schools, as I had quite an exciting number being mentioned earlier on in Limpopo province. They are upgrading toilets and ensuring improved sanitation, safety, privacy, and hygiene so that girls do not become vulnerable. Such positive work by our partners deserves to be commended, and we are thankful for WaterAid for that effort. I thank you.
Thank you for that, Minister. As you have all heard, the Minister is saying that as from the 2019-2020 financial year, the government of South Africa has unconditionally committed finances towards menstrual health. And this speaks to the Minister's previous comment on South Africa being one of the only countries that have a specific policy and monetary focus on menstrual health management. I hope I'm pronouncing his name or her name correctly. Rita Van Charles says, this is extremely great news for our young ladies. Is the Western Cape included in this? We also have numerous young people, indigenous females, who need assistance in this regard. Collaborate with us. Also, thank you. I think, Minister, indeed, from what you have provided, indeed, this is inclusive of all 9 provinces in South Africa. We will now move to Mr. Adera. Mr. Adera, we recognize the efforts made by the WASH community this past year, as you have also outlined in your previous comments. And particularly, I want to highlight the launch of the Sanitation and Hygiene Fund. What was the role of WaterAid in driving the coalition's resource mobilization efforts to be tabled in the Sanitation and Hygiene Fund? And in addition, what bottlenecks have you identified in ensuring better government commitments to policy change and funding for WASH and related issues of menstrual health management? Over to you, sir.
Thank you very much for that. I think I will start first of all with the question of how how do we expect to assist and work together in the South African menstrual health coalition to mobilize resources. So I think I would want to say that one of the key things that we have to do as partners in this coalition is to engage, I think, and unlock the private sector financing. And I think if you are able to engage with the private sector like Kimberly-Clark's, Procter & Gamble, Unilever, we might be able to, look at not only the financial aspect of the resources, but also we could also look at the expertise and some of the skills in looking at the technology and the production of, the innovations in production of some of these hygiene products that would be able to support our women and girls during menstrual cycle. So I think one of the key drivers of what we'll be doing is to engage with the private sector to unlock the financing for menstrual hygiene priorities that we have set. The second one, I would say, is WaterAid being a global organization and a regional global organization, we have a huge database of current donors that are supporting us, not only in South Africa, but globally, and would be willing to work with the coalition members to design very high quality, proposals that we can then share, with our donors in our databases and see if they can be able to commit also further resources for the South African menstrual health and hygiene coalition. So we would be able to provide that platform for for the members to also tap into our donor database. So in terms of financing, resource mobilization, that's what I could be able to mention. But the second question was related to where is the bottlenecks, in terms of where we see these challenges, especially with government commitments. I would like to be very honest here to say that South Africa actually has very good policies, very good policies and plans. And I think if you look at it, most of this compared with developed countries, in UK and other places. But I think the most serious challenges is the inadequate implementation. And this is where I think we would like to see some improvements. And this is related to the capacity, for example, in some service delivery providers, like in the municipalities, we need to get more skills, more capacities who are able to implement the, like wash services, water, sanitation, and hygiene are actually not being implemented properly. Even the policies are there, but we are, I think the government have struggling to actually implement those good policies and services because of the service providers, which I think mainly is the municipalities. I think, secondly, I would also say, and most of you have read the Auditor General's reports, which comes out every year. So the municipalities, most of them are dysfunctional and also, as I said, lack capacity. And especially in driving and providing, clean water, sanitation, and hygiene. And because of that, you find most of our women and girls who are in menstrual hygiene, once you lack water in schools or you lack water in healthcare facilities, you definitely are not helping to facilitate, women and girls to have menstrual hygiene in dignity. So this is an area which I think the government needs to look at, but mainly I think the sustainability of the wash facilities and wash infrastructure that are in place. So you find that, for example, water facilities, the government has actually reached almost 90% of people with access to water, clean water. But in reality, most of these facilities are not functional. So you probably might find about 30 to 40% of these facilities non-functional. And that means that those our women and girls would not be able to get clean water to actually go through with dignity their menstrual cycle. So I think sustainability, and it also relates to the engagement of communities in how they can be empowered to manage their own facilities and resources. I think we tend to use a lot of contractors who just go into communities, construct things, and then go out. When those things are not working, communities do not know how to manage them. So I think some more of engagement with communities, making sure that communities are participating in constructions and decisions on how these facilities are supposed to be built would help a lot in terms of ownership and ensuring sustainability and moving that forward. So that is another bottleneck. The last one I would like to mention is, I think generally government is not prioritizing sanitation and hygiene. I think we have done very well. South African government have done very well in the water aspect, but I also recognize we still have almost 10% of the population, especially the marginalized, that don't have access to water and sanitation in rural areas, in informal settlements. But I think you will find there's a lot of resources sometimes put in water, but sanitation and hygiene is totally neglected, and resources are very little in here. So I would like to say, if you look at COVID-19, I think it has given us a lesson as a whole, not only government, but all other stakeholders, to know that we need to actually pick up and put more resources in both access to water, sanitation, and hygiene. And mostly these must be models of female-friendly, which also are able to ensure that menstrual hygiene, which for girls and women, are actually made easier. So it's not just about toilet, but it's about female friendly. And WaterAid has actually a kind of guidelines of these kind of female friendly toilets that we can actually share with stakeholders, for the public places and also in communities. So this is something that I would like to see more financing. But I had mentioned earlier, we actually commended the minister who is present here, the Nkoana-Mashabane, for her bold leadership in standing in parliament and saying, look, I'm allocating more resources to women and girls in poor areas for sanitary pads. That is excellent. That's the kind of leadership I think we need, and we need more of this for other leaders to be able to look at that, because we are addressing the most vulnerable and those that actually need the support most. So I think one of the last one I would mention, there's slightly also we start seeing a lot of priorities because of COVID-19. More resources are going to health. And so we know we need vaccinations, yes, for COVID. We know we need other things, but we still have to make sure that resources are diverted to wash. Water, sanitation, and hygiene is very key in menstrual hygiene management for our women and girls. And I think that all the leaders should be able to still make sure that resources are allocated there rather than just more in health and not in wash. I would say thank you. I will stop there. Thank you. For our women and girls. And I think that all the leaders should be able to still make sure that resources are allocated there rather than more in health.
Sorry, did you get that, Mr. Adera? I'm hearing
I think, no, I stopped there. I don't know why you're not coming in.
Yes, I was hearing an echo of your previous conversation, but not to worry. I was thanking you for your remarks, and I was saying before you get off the screen, you do have comments on the chat from Shamila Ramjawan, who says that are there opportunities for women-owned businesses to become implementation partners of WASH? Then there's also Noguzola, who's asking about budget allocations that are already existing that we can use instead of just going for the private sector to unlock the funding.
Yeah, so I would say that, so the first question is yes. I mean, in terms of promoting the women, I mean, small scale micro enterprises for women groups in the WASH sector, absolutely. We would like to encourage that. And I think one of the things that we have tried to do in some countries, and I would give an example in the Swaziland, for example, we have organized women in associations and taught them how to make soup, for example, soup making. And they're making the soap and using it for, washing their hands with water in rural areas, but they're also selling this. So it's also acting as livelihood. So yes, there's a lot of other micro enterprises activities that we can promote to support the WASH sector. So, and that is actually one of the key things that WaterAid does actually, and engaging with others. In terms of the financing, I would say that right now, I would say we would like to see all the stakeholders, be they governments, and we do not actually want to just be saying, oh, government should do this, government should do that. But I think all of us, and that is why the South African Coalition for Menstrual Health and Hygiene was put, so that all the other stakeholders, be they private sector, be they civil society, be they, basically other, leaders of society, to come together and see what can we contribute. Of course, we expect government to take leadership in terms of allocating more budget, and I think government have to demonstrate that, but we also expect other stakeholders to provide resources and other skills, not only financing, but also capacity, technology, innovations, to be able to actually invest in hygiene management, menstrual hygiene management for our girls and women. Thank you.
Thank you so much, Mr. Adera. We are unfortunately could not get Ms. Mutali back on. Her network has let us down today, as technology would have. But not to worry at all. We are joined by an industry steward in the form of Dr. Ntsiki Mazini Matebula, who is no stranger on menstrual health management. She is currently the program specialist on SRHR and HIV/AIDS linkages at the UNFPA South Africa. So I'm going to ask her and to try and summarize both questions that we had earlier on UNFPA's role in moving the needle forward for menstrual health, and also just ask her to reflect on the past year. Oh no, Ms. Mutali is back on. Ms. Mutali, I just want to confirm before I carry on. And are you back on? Are you able to hear us?
Yes, I can hear you if you can hear me.
Perfect. Yes, we hear you loud and clear. So Dr. Mazini will not be joining. We still have Ms. Mutali on the line. Ms. Mutali, I was just saying if you could kindly let's go back to the first question, summarize it real quick in terms of UNFPA's role, and then reflecting on the past year on how the UNFPA's participation in the coalition has moved the needle forward. Over to you, ma'am.
Thank you. I hope you can still hear me. And apologies for that technical glitch. So I'll be very brief and just recognize the Honorable Minister and the panelists, and really appreciate everybody's participation. The Menstrual Health Coalition has been a true partnership for everybody. And for UNFPA, I think what I'll go back is just to note that when the COVID-19 pandemic broke out about last year, it was actually just 3 months after the landmark Nairobi Summit on Population and Development. And this was a summit that was attended by over 150 government delegations, civil society partners, private sector and developmental partners. And what the summit did was really look back at 25 years, the progress that we had made in sexual and reproductive health. And what came out clearly is that significant progress had been made, but there were gaps that needed to be made. So governments did come up with commitments. South Africa government was one of those that was a key player, and it did make some commitments. A key commitment made by the government of South Africa was that of improving provision of sanitary towels and the whole sanitary health of young adolescent girls and women across the board, particularly those most in need. And for UNFPA, we committed to continue working with government efforts. We then followed up with that. And during the launch of the coalition last year, one thing that we stressed was the life cycle approach in sexual and reproductive health. That life cycle approach, which makes sure that young girls and women get access to their menstrual health needs from menarche to menopause. And a year later, UNFPA's commitment in moving the needle towards menstrual health, it remains steadfast and it has continued to grow. You may recall that we were quite quick in partnering with the Department of Women, Youth and Persons with Disabilities, as well as Department of Social Development, Water Aid, Footprints Foundation at the outbreak of the pandemic. And we did this recognizing that periods do not stop during pandemics. We committed approximately 4 million rands in procurement of soaps, masks, sanitizers, sanitary towels for girls in shelters in Gauteng, Eastern Province, and KZN. And we also worked with traditional authorities in these provinces to ensure that those most in need had access to their menstrual health services and products. Additionally, we also have worked with a coalition platform to advocate for safe and quality products by supporting e-training of 40 chiefly owned women manufacturing social enterprises on reusable sanitary towels. We have also engaged on the advocacy platforms to develop material with the coalition, and also our commitment in moving the needle forward has included working in supporting sexual and reproductive health training to ensure that there is a module that integrates menstrual health management, such that menstrual health management becomes part of the SR, sexual and reproductive health training. So in brief, our contribution to moving the needle forward has not been done alone, but it's been done collectively with others. And for us, the South Africa Coalition on Menstrual Health Management has therefore been quite strategic, as it has recognized the power of partnerships. If I could go on, may I just go on very briefly in terms of how we see the partnerships working. The UN, for example, I think when it comes to partnership, the UN, you will recall that we all work towards the Sustainable Development Goals. And Sustainable Development Goal number 17 has been one that is very key for us, as it is the one on partnerships, and strongly brings out the fact that none of the Sustainable Development Goals can be achieved without partnership. And hence why we really recognize the coalition as very key in terms of the partnerships. In this regard, in addition to the areas that I mentioned, UNFPA has continued to partner with a broad stakeholder of partners, including within the UN. A key example is the partnership between UNFPA and UNICEF, where we committed over 3 million rand to support a collaboration with the Department of Women, Youth and Persons with Disabilities. We did this through a joint program which is entitled Empowering Women and Girls to Realize Their Sexual and Reproductive Health Rights in South Africa. This is a program that's implemented in KwaZulu-Natal and Eastern Province. Activities have included procurement of products, designing of IEC material, disbursements of products in schools, as well as development and implementation of an M&E framework that will be very critical in the menstrual health management program. We're also working on documenting of stories, lessons learned, which will help enhance our programming as we move forward in terms of increasing access to menstrual health management. The research on reusable acceptability study of reusable menstrual health products is another one that we have worked on. So in terms of, very briefly, our partnerships have been strong, and for us, we note that for continued enhancement of our work in increasing menstrual health management, partnership will be key. But I think key to this will also be the need for us to coordinate our efforts to ensure efficiency and effectiveness and the overall impact on the ground. So coordination of all our efforts will be very key if we are to be successful in achieving our long-term goal. So that's what I've tried to be very brief on. Thank you.
Thank you, Ms. Mutale. Indeed, I am very happy that we managed to get you back on. Otherwise, we would have lost all the nuggets and insights that you have shared. There was a question on practical ways to improve implementation, but I think you have definitely comprehensively touched on implementation in your highlights. However, there is still another question from Nukzola. She asks whether or not policies may be strengthened for us to find ways to educate individuals in society to take responsibility and meet the government halfway.
Thank you for that question, and it is a very important question. I think we all recognize that the whole area of menstrual health management is one that hasn't received the attention that we need. It's a very recent area, and in that regard, I would agree with the with the participant who raised this question, we need to work a lot on policies that will increase access, that will enhance access, particularly for those most in need. But more important, I think, is also as we look at the policies, we will need to ensure that we follow up on implementation of those policies.
Indeed, indeed. And you have said this in your comments, and it has been raised also by Mr. Adera, that we do have incredible policies under the leadership of various departments, including the minister's own appraise. However, we do need to strengthen our implementation efforts. I'd like to now call up on Ms. Mtiane, who's going to be representing the SA Coalition for MHM and the Department of Water and Sanitation, and she will be speaking on reflecting on the coalition's past year. What efforts have been made by the coalition to mobilize resources, Ms. Mtiane? Is there an indication of collective effort in fundraising, and what can be done to strengthen this area? You are on mute.
Oh, okay.
Thank
you. Yes. So what I was saying is there has definitely been a movement in the past year where we saw government departments, civil society organizations, basically the partners of the coalition, being very instrumental in availing both human and financial resources towards the work of the coalition. Firstly, implementable programs were designed. So this was just not done in the vacuum. So there's a clear direction of where the coalition is going. And then when the COVID kicked in unexpectedly in the world and in South Africa alike, there were a new set of challenges which we faced when the schools were closed down. Minister earlier mentioned that the program is targeting quintiles 1, 2, 3, and 4, if I'm not mistaken, of the schools. So with the schools being locked down and the COVID regulations being affected, it meant that it presented a huge risk in terms of how the program was going to be moving forward and implemented. The partners were brought together again with the Department of Women, Youth and Persons with Disabilities, steering that efforts to say what do we have that we can bring together and change our way of thinking and apply a different approach. The Department of Social Development came into play with the social development channels being used to access the children at home, and also enhancing, the baskets of services as well as the materials that are normally provided to them at schools from the donations that came from the partners. So we had sanitary towels coming in, more than what budgets the government alone would have budgeted for. We have the personal protective equipment being also increased. We saw the advocacy materials in the different areas that are the key pillars of this program, which is WASH, which is the reproductive health, also being brought into that basket of services and materials that were distributed to our young girls. So that is what has worked very well in the past year to mitigate against the negative impact or the high risk that was presented by the COVID pandemic. Obviously, like the other speakers have highlighted, there can never be enough. Even if you look at the fiscus, the issues of funds being regulated, the budgets are, gazetted, they're specific. So we definitely need more materials. We need more funding so that we can stretch out and reach much more girls than we are reaching at the moment to expand basically the footprint of the services and the materials that are being provided to the girl children.
Fantastic. It sounds absolutely necessary, Ms. Mtiane. We do have a question here from a Mr. or Ms. Davids. He or she wants to know, why is it not the responsibility of the workplace to be providing women with sanitary dignitary packs? Why is it not their responsibility to be ensuring that we have wipes and sanitary disposals packets in the workplace, so that women are better equipped in that regard. You muted again, Ms. Mtia.
You're muted, yeah.
I'm sorry. I would say the fact that we are seeing a recognition of the different sectors being brought together is already acknowledging the fact that this is not an initiative that needs to be driven by only one sector of government or one sector of society. So that responsibility may be there, but assistance would be given in terms, or would be needed in terms of providing that enabling environment. We know we have constraints in terms of the budgets, in terms of the technical skills, depending on what needs to be done. When you look at the holistic value chain of menstrual health management, it has been highlighted by other speakers, it's not just limited to the sanitary products. Other factors come into play. Your wash, it requires the actual toilet facility to be there, not just the facility, but your hand washing facilities as well. You need to have a disposal system in place. So it's a number of aspects that needs to be really looked at, and that is why the coalition is really important and playing a critical role in making sure that all these, where these different mandates are sitting, they can come together and produce sort of a collaborative initiative or effort to make sure that all these aspects are being addressed.
Thank you so much, Ms. Mtiani. You do raise a very valid point around ensuring that all stakeholders are actively participating in the coalition. Just to address Mr. Pillay, on whether or not the Department of Basic Education is currently engaged. The Department of Basic Education, Mr. Pillay, is indeed part of the coalition, and we would really much will be in touch to ensure that you are not just part of it, but you're actively involved in the work of the coalition. I think what today has highlighted above all is the reason why development partners have come together under a joint coalition of both government and civil society to support national level efforts to lead and own menstrual health solution, which in the long run will ensure long-term impact and sustainability for our country and also for Africa, as the SA Coalition is part of the African Coalition for Menstrual Health Management. On that, I'd like to invite everyone on the call today to register for the African Coalition for Menstrual Health Management Virtual Symposium under the theme, Improving Menstrual Health Management in Africa, which is scheduled from the 25th to the 27th of May. You can register on www.mmsymposium.org. With that, I would like to thank the Honorable Minister. Minister, I think you have heard today repeatedly from our various speakers how grateful everyone is for your leadership in ensuring there is a decisive and deliberate inclusion of menstrual health in government policy, but not just in policy, but also in monetary commitments. Thank you for joining us today. I'd like to thank the UNFPA under the leadership of Ms. Beatrice Mutali, who's the representative for South Africa and country director for Botswana and Eswatini. Thank you, Ms. Mutali, for all the work that UNFPA has been doing on menstrual health management and especially for organizing today's event. I'd like to thank Mr. Elijah Adera, the Regional Program Manager for Water Sanitation and Hygiene at WaterAid, for his contribution and the work that WaterAid is doing towards a decisive response to menstrual health management. I'd also like to thank Ms. Thobile Mtiani, Deputy Director for Policy Coordination and Assessments from the Department of Water and Sanitation, who has also outlined the work that the department has been doing around WASH specifically for menstrual health management. Today has been a really insightful program that is on moving the needle forward for menstrual health by the Mail and Guardian and the UNFPA in partnership with the Department of Women, Youth and Persons with Disabilities, led by the South African Coalition on Menstrual Health management. Thank you all for joining us today. Please stay safe and goodbye.
Thank you.